Again, welcome to the Wholesome Wave National Nutrition Incentive Network webinar on building equity, participant leadership, and nutrition incentive programs. My name is Ava Agudelo. As I said, I'm a program manager at Wholesome Wave, and I'll be facilitating this webinar today along with my colleague Elizabeth Atwell. She will be keeping an eye on the question box and responding to any technical questions as we go through the training. Thank you, Elizabeth. Here are our presenters for the day. Dominique Hazard is the Outreach Coordinator for DC Greens. Suzanne Babb is a Community Partnership Manager for the Nourish Network for the Right to Food at Why Hunger. And Abby Brewer and Jennifer Crouch join us from Live Well Montrose Olathe in Colorado. And Jennifer is a local pharmacy prescription participant. You will learn more about all of these presenters, their programs, and organizations as we get going into the presentations. This webinar has been based on a highly successful plenary session from our 2016 Transforming Food Access Summit, and it will feature incentive programs that engage program participants in order to build towards more equitable systems and foster leadership by those most impacted by systemic inequities. So we want to help attendees understand the ways that structural oppression and other systemic factors can be addressed through nutrition incentive programs and opportunities to develop leadership by those most impacted by their programs over the long term. So these are some big questions that we want to start thinking about. Why do we engage participants and foster their leadership? What are these systemic issues that we're talking about, and how do they impact our ability to serve our customers? And what strategies exist to address these inequities in the context of our work? So this is a topic that many people have indicated they're very interested in grappling with across the network, and we're really thrilled to be able to start the conversation and continue other conversations that have already been happening and bring some of this expert feedback to you on these really important topics. Before we get started, I just want to give you a very quick introduction overview to the National Nutrition Incentive Network, of which you are all a part. In 2015, we reached over 50,000 consumers, 6,000 farmers, and leveraged $3.3 million in incentives and federal benefits nationally. At the start of 2016, our network has 105 members in 39 states and DC that together represent over 800 direct-to-consumer markets, including farmers markets, CSAs, and mobile markets. Very proud and excited to bring together this group of practitioners. So these graphs show a steady increase in the number of incentive programs, as well as sites. Consumers and farmers also have been increasing, and these folks are all served by nutrition incentive programs. And this shows since 2008 when Wholesome Wave started its operations. And with this growth in the field, we really recognize the need to support the building of capacity of incentive program operators as they move from the very beginning, stage 1 of starting programs, through growing their programs to serve more customers, and what we call stage 2. And these higher capacity markets can link together and expand into statewide or regional networks in stage 3. And finally, once fully formed, stage 4 regional and statewide networks look to engage in programmatic innovation, research, and advocacy to make the case for incentive programs with policymakers at the national level. The staff of the National Nutrition Incentive Network help to support programs along the various stages of growth through our network services shown here. First, tools and technical assistance, such as this webinar and other web-based trainings, toolkits, and in-person direct assistance. We also gather data about incentive programs at the national level and make this information available for educational and advocacy purposes. And finally, we've developed and are continuing to expand upon our resources for incentive programs to engage with one another in a community of practice via a listserv, newsletter, resource library, and annual conference. If you have any questions about how to get more involved in the network or take better advantage of network resources, you can contact us at Wholesome Wave or contact your program's network administrator to find out more. Great. So now I'm going to turn things over to our first presenter, Suzanne Babb from Why Hunger. Why Hunger is a leader in building the movement to end hunger and poverty by connecting people to nutritious, affordable food and by supporting grassroots solutions that inspire self-reliance and community empowerment. As Community Partnerships Manager, Nourish Network for the Right to Food, Suzanne supports the capacity building of community-based food access organizations through shared learning around the intersection of hunger, health, and poverty. Through participation in local and national level strategic partnerships, Suzanne helps to create space and facilitate dialogue around the systemic inequities that cause hunger and poverty. Suzanne, go ahead and take it away.
Thank you, Eva. And as Eva mentioned, I work at Why Hunger, and we are a grassroots support organization, and we work both domestically and internationally to support grassroots-led social movements. And my department, the Nourish Network for the Right to Food, works with emergency food providers, food access organizations, community health organizations, and other grassroots and national allies to transform the charitable response to hunger in the U.S. into a more equitable and inclusive social justice movement that recognizes nutritious food as a human right. And so we're going to be talking about creating nutrition incentive programs that are more equitable through participant leadership. And so in order to do that, I wanted to talk about why it's important to look at the systems in which nutrition incentives exist in and how they affect people who participate in those programs and how we can use them as a tool to address those inequities. Next slide, please. So nutrition incentive programs address this important intersection between hunger, food insecurity, and health. But we know that hunger and food insecurity are symptoms of poverty, and that poverty influences the food choices that people have to make. We also know that health is a result of individual and environmental factors, and that poverty is one environmental factor that determines access to healthy, affordable food. And so these 2 points really help to explain the need for nutrition incentive programs and the vital role that they play in helping to address food insecurity and poor health outcomes. So by addressing access to affordable, healthy, fresh food, these programs seek to address the inequities that exist within our food system for many communities, mainly communities of low income levels and communities of color. Next slide, please. So a few questions to ask. If nutrition incentive programs were to go away, how long would it take for poor health outcomes to resurface and for health so entrenched in certain communities? And again, this is more in communities of color where income levels are persistently low. Next slide. So I think part of the answer may lie in looking at the environmental factors that influence a person's health, more commonly known as, in the public health world, as the social determinants of health. Health is affected by individual choices in community, environment, culture, connectedness, and institutional policies and practices. The social determinants are outside of a person's control and can have helpful or harmful effects on a person's health. Social determinants are in part responsible for the unequal and avoidable differences in health status within and between communities. So I want us to take a look at a slide from Healthy People 2020. If you just go to the next slide. And we'll call this Social Determinants 1.0. And so each of these 5 determinant areas reflects a number of critical components and key issues that affect health outcomes. So under economic stability, you'd be looking at things like poverty, employment, income level, and housing stability costs. And under education, we'd be looking at determinants like high school graduation, enrollment in higher education, language and literacy, and early childhood education and development. Under social and community context, we'd be looking at social cohesion, civic participation, perceptions of discrimination and equity, and incarceration and institutionalization. Under health and healthcare, we'd be looking at access to healthcare, access to primary care, and health literacy. And then finally, under neighborhood and built environment, we'd be looking at access to healthy foods, quality of housing, crime and violence, and environmental conditions. So in this 1.0 version, access to healthy food is just one critical component in determining health outcomes. But here's the thing. The diagram assumes that these determinants collectively affect each person's health in the same way, all things being equal. So let's look at a different version of social determinants. We'll call this 2.0. And this was created at the Gathering Wisdom Conference, which is a First Nations health conference in Canada. And so this slide includes some of the same determinants as the previous slide, but the difference is that this version recognizes that all things are not equal. It shows that there are other factors at play, systems of oppression that affect women and people of color more persistently that show up in the form of racism, sexism, that are rooted in a history of colonialization and social injustice. So if we go to the next slide, these systems of oppression create persistent inequities in access, resources, and opportunities that impact health. In other words, you have a society where certain communities have more power and privilege than others. And because this diagram was created by the communities that are directly affected by these issues, it shows a fuller and a deeper analysis of what needs to be addressed to bring about better health in their communities. It also underscores the importance of a culturally appropriate lens. So for example, this diagram, again, was created by the First Nations community, and they asked questions like, does the land where I live have clean water? Are there good jobs, health services, and safe housing? How does racism, colonialization, or local control of resources affect wellness of both the individual and a nation? And what are the intersections between wellness and the justice system, self-determination, child protection, and revitalization of language? Next slide, please. So although these concepts seem very big and they can seem very theoretical and abstract, the point is that all of these factors play a role in poor health outcomes and food insecurity. And these imbalances of power and privilege and the inequities that create them get played out in every space in which we work, live, and play in, including our own organizations and programs. And in all of these spaces, there is an opportunity to shift this dynamic. So I want to end my presentation with a couple of questions that I think summed up what I've talked about. So if we go to the next slide, as we're listening to the other presentations, let's think about how we can make nutrition incentive programs more equitable for those who are participating in them. How can we shift the power dynamic in nutrition incentive programs? How can we demonstrate and value people as experts in their own experience? And how do our programs change or evolve when we use a lens that considers the root causes of poor health in the first place?
Thank you so much, Suzanne. That was some fantastic context. I really appreciate it. And now to talk a little bit more about things that are happening on the ground around these issues, I'm going to turn it over to Dominique Hazard from DC Greens. So I'm going to make her presenter now. And DC Greens uses the power of partnerships to support food education, food access, and food policy in the nation's capital. As outreach specialist, Dominique spends her days talking with her neighbors about ways to access fresh local food. Thanks so much for joining us, Dominique. Go ahead.
All right.
Oh, wait, hold on a second. You're not sharing your screen with us yet.
Okay.
I want everybody to know that we did practice this about 15 minutes ago, and it was very smooth. Okay, there we go.
All right, great. All right, so again, I'm Dominique. I'm from DC Greens. We are an organization that works on food access, food education, and food policy in the district. And today I want to talk a little bit about our Community Champions program, which is a program of DC Produce Plus. So I just want to give you a little context of what Produce Plus is, so you can understand how our community champions, the context that they're coming from in the program that they're working with. So Produce Plus is a program implemented by DC Greens, but it's a program of the DC Department of Health. And through Produce Plus, residents or customers really can receive $10 to spend on fresh fruit and vegetables with every visit to a DC farmers market. And they get these $10 in the form of vouchers. Folks who qualify to receive Produce Plus are any DC residents who receive Medicaid. So in DC, we're talking around 255,000 people who qualify through Medicaid. Anybody who receives SNAP, which is 140,000 people, many of whom overlap with the Medicaid group. And also any DC resident who receives WIC, TANF, SSI, or Senior Grocery Plus. So there's 38 distributing markets in DC where people can go to the farmers market, show a DC ID, and show proof of participating in one of these programs, and get $10 every time they go. And so if somebody goes to the same market every week, they would get $10 every week. If they go to 5 markets in one day, then at the end of that day, they would have $50. There's 44 farmers markets where Produce Plus customers can spend their vouchers. And to help implement the program, we have about 150 volunteers who volunteer at the farmers markets across the city, actually writing out the Produce Plus vouchers. And this program is funded, well, last year it was funded entirely through the DC Department of Health using $415,000. This upcoming year, we'll have the same funding from the DC Department of Health, and we'll also have some outside funding. And so piggybacking off of the last presentation, in designing this program, we are thinking a lot about equity, and we think that an important way to get towards equity in our program is through participant leadership. So we are trying to support participant leadership or participants' engagement with Produce Plus in 5 different ways. So one is through participation. We want people to use Produce Plus. The second is through outreach. So I'm the outreach specialist of DC Green, but I cannot reach all 255,000 people at least who qualify for Produce Plus in the city. And so what we found is that most people are finding out about Produce Plus from their family and from their friends. And so we think it's really important to have participants involved in outreach and spreading information about the problem or about the program. The third way is through implementation. So I mentioned that last year we had 150 volunteers writing out the Produce Plus vouchers. Many of those volunteers were themselves Produce Plus recipients. And so everywhere that we go and spread information about Produce Plus and how to use Produce Plus, we also provide information about how to volunteer for Produce Plus. And last year there were some sites where the farmers markets, because of complex rules, some farmers markets in DC are not allowed to distribute Produce Plus without a volunteer being there distributing it for them. And so some farmers markets literally would not have been able to distribute Produce Plus if people from the community, customers of that market, hadn't stepped up and said, we want to volunteer, we want to make sure this is happening in our community. As I said, most of our funding for the program comes from our city Department of Health, and so it's really important that since we are getting this government funding, and since they're really dependent on support of our city council and the city administration, it's important that customers are coming out and communicating to those policymakers how important the program is to them and why it needs continued funding. So our biggest way of enabling these 5 types of participation in the Produce Plus program is through our Community Champions program. Last year was the first time we tried this at DC Greens, and we think it was pretty successful. We had 4 community champions, and 2 of them are here on the screen. On the left is Ms. Beatrice, and on the right is Ms. Hattie. And through the Community Champions program, we support community members and Produce Plus customers specifically who are really invested in the program and engaging in all 5 of those types of participation. So I'll tell you a little bit about these 2. I'll tell you how I came to know them. So Ms. Beatrice, and I think they really exemplify who our community champions are, because we think it's important to find people who are just already super invested in the program and really excited about Produce Plus, and are actually folks who are already participating in the program at various different levels and telling their community about it, and then supporting them to continue doing that. So Miss Beatrice, I was hanging out at one of our farmers markets in the city, and I saw her, and I didn't know her, and I was talking to somebody at the Produce Plus table when she came up and started getting Produce Plus, and I saw there was a whole group of people, and I was like, "Oh wow, you all came to the farmers market together." And the speaker said, "Well, actually, I don't know these people, but we were all." These are just some folks who were on my bus, and I'm so excited about Produce Plus that every time I'm on the bus, I make a speech about Produce Plus. And so I told my whole bus about Produce Plus, and then I convinced these folks to get off the bus with me. So I thought, wow, you're definitely somebody I want to have on my team. And then Miss Hattie is a standing figure in the DC farmers market community. She goes to many farmers markets every week, and the markets were telling us there's this woman, and she comes and she takes all of our Produce Plus brochures. So I need some more because somebody took them, and when we asked her what she's going to do with them, she says, well, I'm just going to hand them out on the street because people need to know about this program. And Miss Hattie always says it's no fun for me if I know about it and other people don't. And so when we're looking for our community champions, we're really trying to find these type of people, again, people who are super invested in the program and already committed to making sure that their community knows about the program. And so we've found out about community champions while hanging out at the farmers market, recommendations from the farmers markets that we partner with, recommendations from service providers such as clinics and recreation centers, and again from some of our more enthusiastic volunteers who are also customers have ended up becoming community champions. So again, the community champions are really participating in all 5 of the types of participation. They're Produce Plus customers themselves. They are really the most important outreachers. Like that, I can never do as much outreach as they can because they are part of their communities and they have access to. They have knowledge that I don't. They have access to people that I don't. They have insights that I don't, and so. They're all engaged in outreach, talking to people, handing out brochures, answering people's questions. Some of our community champions even will help out with health fairs and things like that, working booths. So they're really, really important part of the DC Greens team in terms of outreach. Implementation, again, many of our community champions, aside from participating in the program themselves and doing outreach about the program, are also volunteering to actually write out the Produce Plus vouchers. Feedback, community champions are one of our most important sources of feedback because they have the scoop. So, last year we trained all the volunteers for Produce Plus, and so it was through the community champions last year we heard that some of the volunteers were concerned or confused about what constituted a DCID, and we're only accepting driver's licenses and not accepting DC1 cards, which is another form of ID in DC. And so having the community champions really providing their own insights, but also funneling back into the program feedback and suggestions from the community is really important. After the farmers market season was over, we continued to work with our community champions, and each one of them actually helped pull together a feedback session of at least 15 people where we did a whole hour-long feedback session with these groups, really getting their feedback and insights about how we could improve the program for this upcoming year. And that helped us redesign our materials, that helped us redesign our volunteer trainings, which is really critical. And then finally, advocacy. So additionally, in the off-season, the community champions were busy organizing their communities to participate in advocacy. And so all of our community champions helped collect letters that we submitted to City Council. They came to City Council hearings and told their stories about how Produce Plus had impacted their lives and why the program is important. And so we think that they have been instrumental in helping us to continue to secure funding for this program. And this is our community champions team from last year. We have 4 community champions from across the city, and this year we're hoping to have about 8 community champions. So some more details about how the program works. This year we had community champions. They all started at different times as we met each other. But our first community champion started on June 1st, which is when Produce Plus starts. And we worked with them all the way through the end of February. So that's how many months is that? That's 8 months. So 8 months out of the year, the community champions were working with us. Every month, they received a stipend of $144. Just estimating that during that month, they would probably have done about 12 hours of work. And so we compensate them for $12 per hour. And we additionally try to connect our community champions to as many other opportunities as possible. So, recently we've connected one of our community champions with Center for American Progress Poverty Talks blog because she's such an excellent writer. And I meet with the community champions at least once a week. Sometimes it might be every other week, but I try to meet with them regularly in person and talk with them even more frequently over the phone to continually get that feedback about how we can be doing better. What questions are people asking? Do you need more materials? So I meet with them regularly, supply them with materials as often as possible, and then at the end of the season, we had a little shindig where they came and it was a more intense feedback session, and it was kind of a party to thank them for all of their efforts. And so all the way through the whole cycle of Produce Plus, from the first day that the vouchers are being distributed all the way until when we're lobbying for money and funding for the next round and collecting feedback to do better, the community champions were really just indispensable. Shall I have 5 minutes? No, I don't have any minutes, do I? I don't have any minutes, but some of the challenges.
You absolutely do. You have 5 minutes. You actually have 6
I have
minutes.
5 minutes?
Yeah, because
Okay.
Dan kept it really brief, so you're good.
Okay. So some of the challenges, I think it's really important to name that when working with the community champions, for me, there's an inherent power imbalance because the women, hopefully they won't all be women. Hopefully we'll have some more gender diversity this upcoming year. But the community champions are all people who qualify for Produce Plus. So they're folks who are in some way receiving federal assistance. I do not receive federal assistance. I can afford to purchase fresh fruit and vegetables without that type of assistance. And so there's that class dynamic there. I'm somebody who's paying them. So even though really I need them, just that power dynamic of me paying them, it can really sometimes color our interactions. And so what I try to do to combat that is one, just always I think having the title community champions has been really important to all of them, and something that they're really proud of and have taken to calling themselves, and I think that I try to just constantly talk about how important they are to this program and how we need them. And I think for this upcoming year, we're also thinking about expanding the Community Champions program. We've had some people who they just don't want to get paid, so I don't want to make somebody be in this kind of constitution or contractual agreement, even though there is no actual contract. There's no job description and there's no contract. So really making the program what each individual person wants it to be, I think is going to be our goal for this year. And also tracing back to what I just said, I think part of what I'm hoping makes that power and balance less harmful is we it's just that element of trust. So I don't like run after the community champions. I don't ask them to keep meticulous track of every minute and every hour they spend talking to somebody. I really keep it. I ask them like, how many people do you think you've talked to, or what events did you go to, or how many materials. I don't even ask how many materials they gave out. I'm like, how many materials do you have left? And so I think that taking away that kind of like clock in, clock out kind of dynamic has been good and has been helpful. And again, it's in no way necessary because these are people who would be doing this anyway, even if they were not community champions, even if they weren't getting a stipend, they're so committed to this, and yeah, they're so committed to this, and they have the capacity to do it, and so they're going to do it, and I just trust that they will. Um, which flows into creating a model for young people. Not only, are they able to do what they're doing because of their passion for Produce Plus and fresh fruit and vegetables, but also as you might have noticed, almost all of our community champions last year were senior citizens. And so I think that the model that we have right now works really well for senior citizens. They have a lot of free time. They can go hang out at lots of markets. They're free during the day. And I think what I'm trying to do now is think more critically about where are places where I might find community champions who can really tap into younger, like young WIC parents, for example. Because I'm not going to find them like hanging out at the farmers market outside of the senior center, on 2 p.m. on a Thursday. And also the model of the way community champions is working right now might not work for them. So we're thinking about having something more flexible, maybe more ad hoc, where maybe you can be a community champion for a month and help the Produce Plus Instagram get more followers or something. So I think we have to think a lot about how to find and support younger people who are doing the same work. We had one community champion who was in her 20s, and she ended up having to drop out last year because the way it's set up just wasn't sustainable for her as she was having a new baby. And then I think the last challenge we've had is evaluating success. So after the Wholesome Wave conference, I got a lot of questions like, well, how do you track, the exact impact of Community Champions program? And we don't. We've only been doing it a year, and we haven't quite. I think that a lot of people have found out about it. I mean, that's what I saw from the number of people the Community Champions were able to pull into these feedback sessions and into writing letters and testifying. And I know they're out there telling a lot of people about Produce Plus. We haven't quite found a way to quantify that. So those are our challenges, but I mean, our pluses is, again, a lot of people are finding out about Produce Plus through these community champions, and we're really trying to harness the knowledge and networks and enthusiasm of Produce Plus customers. So I think we're doing that, and I think as a result, we're helping to kind of shift the power dynamics of this program. Thanks.
Thank you so much, Dominique. That is fantastic. And what a great overview of a really fantastic program. I really want you all to know that this is one of our favorite programs to share with network members who say they're having issues with outreach, because it's just so powerful and effective. And Dominique, we did have one question for you, which was quick. Is the $415,000 of funding the size of the pot for incentive redemption, or does that also include admin and overhead on the program?
Yes. So last year, that was the size of the pot for the program. This year, it's been contracted out, and it actually is the combined admin and pot for the program. But we're hoping to have some additional outside funding this year for the pot of the program, so that it'll be at least as much as it was last year.
Great. Thank you so much. So now I'm turning things over to our last presenters, Abby Brewer and Jennifer Crouch from Valley Food Partnership and Live Well Montrose Olathe. Elizabeth knows how I'm saying that wrong, so I'm probably still saying it wrong. So their mission is to empower the community, encourage active living, empower workplaces, and create a culture of healthy young people So I'm sure we'll hear much more about that program from Abby and Jennifer. Take it away, folks.
Yeah, thank you so much to Wholesome Wave and to everybody that's on the call today for having us. We're so excited. We're a small community. So we don't really have a we call it blossoming where you're planted. So I've got Jennifer Crouch here with me, who is one of our participants from Local Pharmacy X from last year. Say hi.
Hi. How was everybody?
So I'm going to talk a little bit about us. Let me see if I can. Okay, technical difficulties. You guys can see my screen, right? Okay. Right. So we are Valley Food Partnership is our mothership. We are a nonprofit organization, and we're housed within Valley Food Partnership. We have several different strategies, and we're on the western slope of Colorado, very small rural community. In 2012, we developed a Growing Healthy Communities Coalition with Live Well Montrose Olathe, and one of our priorities was increasing healthy local food consumption in the communities of Montrose and Olathe. Among those residents that have incomes that are low or below 180% of poverty. And so what we discovered is we needed a strategy and for this food access and to actually get more local food access to community members that are currently taking SNAP benefits or having SNAP benefits. And what we did was we developed a program which was called Local Pharmacy RX. So Local Pharmacy RX is an incentive program, and you guys know a lot about different incentive programs. This particular incentive program, one of the things that we did was really braid in leadership development. It was right from the start, as we really wanted to make sure that the people that participated in the program and the vouchers, we developed leaders from there. So with that, what we decided to do was how we braid those in, so to speak, is with our value statement. And of course, this is a lens that we look through. I'm not going to kind of go over the whole thing, but our value statement is what we believe, and especially in the leadership and health promotion and opportunity for our community. So this was a critical point for us. And we really wanted to make sure that this component was intertwined in every single thing that we did. And local pharmacy, that was one of the major things that we needed from there. And to actually create those leaders and mentors for the program. So allowing the community members to blossom. I mean, how do we foster leaders? And I think that that's really a thing that we all think about. And, you know, DC Greens was talking about the challenges, and it looks like that they do a very good job at leadership development and fostering those champions within the communities. And for us, you know, it's kind of really trying to figure out how to empower those people. And so what we've tried to do is kind of figure out how we do that. And the things that Jennifer and I discussed, we decided accountability and responsibility, listening and storytelling, coaching and training, and building a sense of belonging is really a key point and a lot of points to empowering participants and fostering leaders within our community and within our program. So kind of how we do that, and the thing that we were talking about too is the accountability and responsibility. So what we start off with our incentive program, we provide nutrition education over a 12-week period of time. And what we start with is a survey. And this survey is saying, why do you want to participate in this program? And I wanted to kind of turn it over to Jennifer and ask her, like, when you thought about the program and getting into it, were like these questions important to your commitment?
Yes, these questions are very important to my commitment and to a lot of other people that I connect with in the community. And they also help me decide on, you know, how to prioritize things in my personal life.
So kind of asking those questions, like I said, accountability and responsibility. The second one was making sure that we kind of hold a spot for listening. And I know a lot of people have talked about this in storytelling. So allowing them to, inviting participants to tell their stories and also be part of the solution. Currently, Jennifer actually talked with Livo, Colorado, and they have published some information on the local food shift. And so Jennifer can go into a little bit about the storytelling that she's been talking with other communities about.
Okay. My attraction to this program is because I'm part of that minority in terms of income, and I would have been in either Suzanne's program or Dominique's program if I had lived there, just because your programs, like your community cheerleaders and stuff, they need people who are passionate about change, and you in nurturing that passion. And I'm not here for the incentive anymore. I just know that eating healthy and good health will promote a lot more community and a lot less healthcare costs. We've addressed all of this.
Yeah, and so I did put her local food access, actually her article online. So if you guys, when you get this PowerPoint, you can check that out. It's really good. It's about the food access and local food access, and especially those with low incomes. So coaching and training is another big portion of fostering these leaders and actually empowerment. And I think that what we try to do is seek out and survey participants and past participants and people within the community about their passions and their skills. And so just like Jennifer, her skill is connecting, and her passion is for people, and she wants to be a helper. And I think that that's a really important piece to actually see what their passions and skills are, and inviting them into volunteering and training. We currently host a number of volunteer trainings from community and school gardens to local pharmacy education and nutrition education and beyond. And so we do really try to seek out those skills and those passions and bring them in. There's also the last one, which I kind of put, was building a sense of belonging. And so how we try to do that is actually after our program is over, or we have a 12-week period of time that we do our program, our incentive program. So we start in mid-July and go through October. And so after those incentives are gone, we want to make sure that those participants are also continue with the family. We call it the local pharmacy RX family network. And so we have a Facebook group, potlucks and gatherings that we hold. And actually it looks like that from those different the participants who are gathering and going to those potlucks and also doing Facebook groups are doing other things within the community and are seeding other projects. One of the major other projects that has been seeded is this Conversations for Change. Roots Run Deep. It's a family cafe that Jennifer is running. And she's told me that really one of the kind of sparks from local pharmacy that sparked her to do this was the connections. And so can you talk a little bit more about the family cafe that you're doing?
I sure can. First of all, being in the community, you know, technology just needs to take a flying leap. FaceTime is huge because there's so many barriers that we've talked about, racial barriers, gender barriers, education barriers, and you just sitting down and talking to somebody about what is important to them and what they need for their lives to be better. And our family cafe is based on a program that is nationwide, the Parent Cafe, the World Cafe, and we look at, you know, the aspects of strengthening families, and we invite it's invitation only. We invite our community members to come to these things, and we have very specific conversations about how they feel about what would make the community better. And a lot of conversations, come back to health and eating. So I took off with it, and it's been wonderful. We've got lots of folks now that want to come. We've even got more interested sponsors. And this is all volunteer. This is stuff I enjoy doing because change is really important to me.
Yeah, thank you, Jennifer. And that's exactly what we try to do. So like I said, accountability, it's their choice. They're making the choice. Coaching and training, they say, hey, I want to help. I want to participate. I want to help be the solution. And building a sense of belonging, creating that space for diversity and diverse partners. And that's very important in all the program that we have. Last but not least, what does it take? The resources that we use on our end. So within Livewell Montrose Olathe Valley Food Partnership, we have one full-time staff member dedicated to the local pharmacy RX program. So of course, during the education and the voucher program, that seasonal thing, July through October, but Addie also participates with local pharmacy members beyond that. So making sure that she continues those connections and fosters those leaders. We also have a Vista AmeriCorps, which is with us with the local pharmacy RX, and they are, again, 40 hours a week, who is kind of a program assistant for the local pharmacy manager. Additional support from staff, the director, myself, I put a little bit of time in there, also some contractors. We work a lot with the Latino community, and we have several different leaders within that community, but we also contract a few of the people to help us. We have over 12 volunteers to help with education and participation, and also Cooking Matters, which has developed a curriculum and helps us in a lot of different manners. And also our community partners, our medical providers, Health and Human Services, and local producers. So I see a lot of things that are very similar between DC Greens and kind of our program as well, but I just want to let you know we're very small. So within our city limits in Montrose, we're about 15,000. Our county is about 40,000 people, so we're dealing with a lot smaller community. But that's kind of it. Did you guys have any other questions?
Thank you so much, Abby and Jennifer. I just want to let everybody know that these are new network members. We're so excited to have them on board. And we do have a question coming in. And folks, please feel free to start entering your questions into the question box, and we can get some of those answered. So the first one is, Abby, are there ways in which your program has changed or evolved as a result of participant feedback?
Absolutely. One of the major things that's happened is, especially within the Latino community. So last year we had educators that were just speaking in English and then translating. And so some of the feedback from the participants were saying, from the Latino community, were saying, we really don't understand this, the class is so long, and things like that. And so what we decided to do was kind of change it up around. And so our translators, and we're actually doing the education in Spanish now, and talk about engagement. It was like night and day.
Inspiring. Yep. And I want to, we've got another question. Dominique, wondering if it was possible to provide incentive vouchers to community champions rather than cash, and whether that was a consideration or if you were able to ask folks how they like to be compensated. Great question.
Yeah, good question. Um, we could we do that? I don't know. We have not considered that. I mean, last year, we were not actually the folks distributing the vouchers. It was the DC Department of Health, and we just decided to support the Produce Plus program by training the volunteers um, and running the Community Champions program. But I think now we have the contract in the city. We're running the DC Produce Plus program, and that would definitely be an option. I think it might make it might potentially make more sense in maybe other cities or somewhere where maybe there was more limits on it. But really, right now, the community champions. I mean, if you could just go to every farm, you can go to every single farmers market there is in the city and get $10 every week. Um, so I think they all of them have several different farmers markets that they like to frequent. So I think currently they're all, have more than enough Craigslist vouchers. But I think that's definitely an idea that is a good thing to have in the arsenal.
And kind of related to that, there's another question. How important do you feel like the stipend is for recruitment?
Mm-hmm. Um, hmm. For recruitment. So I think so last year, with our 4 community champions that we had last year, I don't actually think it was that important for recruitment. These were, again, they're already doing this work for free. They're already, taking stacks of brochures and handing them out and arranging volunteer trainings at their senior centers and you know, telling people about opportunities at health fairs. So they were already doing this. And so most people, I would say, hey, I'm from DC Greens. We help out with the Produce Plus program. We'd love for you to be a community champion. I think the big incentive for most of them was getting as many materials as they wanted, because some of them were like making copies of the brochures so they have enough to give out. So I think the real incentive was like, you know, this is an opportunity for you to have as much materials as you want all the time, and to have a place to ask questions that you're hearing from your community and like give feedback about the program. I think were actually the most important tools for recruitment for those 4 that we had. And then I think the stipend is really again about that equity piece, and about the fact like I'm the outreach specialist, I'm getting paid, and we just want to support and value the work that our community champions are doing. It's kind of like that alternative economics. How can you value unseen work, whether it's like childcare in the home or these wonderful women doing this important work in their communities. And so that's why I think we thought it was really important to have a stipend and to have it at what is a living wage for DC. I think, again, that is something that really worked with the specific community champions we had, who are, again, or almost all senior citizens. I think the recruitment that I'm doing right now, which has been focused on women a little younger, like 30 and under. I think it has been something I've been leading with, leading with a little more as I think about different models where maybe there's people who are just hearing about Produce Plus right now, but they're very involved in their communities, and so it would just kind of take a different course where now it's like, okay, I'm going to do training about Produce Plus and maybe ask you to go to specific health fairs or something like that, which would be a much more structured thing. And so I think that the stipend will definitely be important for this kind of different mode of recruitment that I'm doing right now.
That's great. And I think that answer sort of addresses a different question that also came up about paying people versus having them volunteer and seeing how participants could see both sides. Quote, my time is valuable and I deserve to be compensated versus I want a chance to be a giver. So clearly
Mhm.
some of your participants felt the latter. And have you heard more on that topic from other participants? So I feel like we addressed this question, but if you have like a couple sentences that you want to say on that, I think particularly in terms of the concept of unpaid work and things that people were doing that are valuable,
Mhm.
that you are taking initiative on that and saying, we will value you and we will compensate you for that, whether you're asking for it or not, is
Yeah.
really special. Um,
Yeah, I think yeah, again we when we did our kind of feedback on the program, we really had community champions who felt both ways, who were like, wow, it's so great that, I'm out here working hard. It's really great that you're valuing this and I appreciate it. And then other community champions who were like also like totally appreciate it, but like maybe either feeling a little uncomfortable or just saying like this, I just want to help, like I just want to give. And I think both of those are totally valid. And so I think the approach we've taken is to really definitely offer. And then from there, what we're going to be doing is just taking the lead. So it's like, this stipend is available. Would you like this stipend? Because some people don't. Some people don't. For some people, that it's a more oppressive power dynamic to not be getting paid, where it feels like you're being taken advantage of, and then for some people, it feels like a more oppressive power dynamic to like be getting paid and have this organization be like kind of your boss. So I think it's about taking the lead of the community champion.
Great. Thank you so much. And thank you everybody for your great questions. Oh, looks like we've got a couple more. Um, Oh, that's a programmatic question. So asking about FINI funding specifically designated for incentives to be used to reward champions, that I think you would want to follow up with your Wholesome Wave program manager to talk about that a little bit more. Outreach funding can be used in a variety of different ways. Anything that's not dedicated directly towards direct incentives can be used for all different types of program overhead and that sort of thing. But I would take it up directly with your program manager if you want to talk more about how that would work. So I'm just going to move us along really quickly. Thank you, everybody, for attending and let you know about our upcoming webinars. So you heard a little bit about the Valley Partnership prescription program. If you'd like to learn more about prescription programs, prescription incentive programs, we do have a webinar on that specific topic coming up on April 19th. And also a best practices for data collection and accounting on April 21st. If you want to get into some of your nitty gritty of your program admin right before the season starts. And then in May, we'll be talking about retail incentives. June, we'll be talking about participatory research. And in July, we will be talking about program innovations. So there's some really exciting stuff coming up in the webinar series moving forward. I want to let you all know that the listserv is the main way that we get the word out about these events. So hopefully you all are subscribed to that listserv. If you're not, please do shoot me an email. We also send monthly newsletters. We have a resource library where all of these recordings are posted. If you do want to share this recording with anyone, you can just share your registration link, and people can view the recordings through GoToWebinar. We also have toolkits and briefs and case studies and a whole host of other materials on that resource library. So we do hope you'll all take advantage of that. Again, thank you so much for being part of this network and for attending this webinar. And please feel free to get in touch with questions at any point. And please don't forget to fill out your evaluations after the webinar ends. Thanks again to our presenters, and thanks everyone.
Thank you.